Hello everyone, this is Dr. Amanch. Today I'm going to talk about how to trace a mandibular nerve canal. So inferior alveolar nerve tracing. For those who don't know, this is, as the name suggests, tracing the nerve from the most posterior part to the mental foramen. We have many options to do a nerve tracing here, but today I'm going to talk about only one of them. So you can do that in different techniques, but the easiest way I'm using is through multi-planar. So as you see from the screen, we have some options here: view, MPR, slice, cross. You can use the slice, or just using the multi-planar will give you a good image for tracing the nerve. This is click on the multi-planar. We have here from the command section, new multi-planar. As you can see, I clicked on the new multi-planar and a new screen will be open up. Here you can see many other options. For just selecting the arch, or just if you want to view the arch, you have to click on the single panorex setup. And for nerve tracing, you can use this other choice, multiple. You click on this. And as you see here, we have some other options. Click on the freehand. This section is what is going to help you in tracing the nerve. So as you see, you can scroll up and down to just have an overall idea of what the image will look like. As you can see, we can start from the upper arch, from the sinuses. This is from the sinuses. We scroll down. This is the upper arch. And as we go down, the lower arch will be shown through the sections. So from the lower arch, we have to start from the most posterior part. You can use a zoom in, just in case you don't see the nerve, the canal. Move up and down until you see the canal in the most posterior part of the arch. So now, as you can see, this is gonna be the canal. So we have clicked on the freehand and multiple here, and we start from this part. The most posterior part, this is the canal. Just have a click on it, and then scroll down as the canal shows up towards the anterior part, towards the mental foramen. Scroll down a bit. As you see the canal goes on, it's just like an encircled shape. You can visualize the canal as you go on to the anterior part, up to the mental foramen. See the canal here? Just don't miss any section. Have a click on it. As you can see, we have an impaction of lower wisdom tooth, lower left 8. This is going to help the surgeon so as to avoid any possible complications when doing the surgery and removal of the wisdom tooth. So scroll down a bit. There is the canal here. Just look for an encircled shape or a line, maybe sometimes. There may be variations, anatomical variations in some cases, but the more cases you do, the more easy it will be for you to do nerve tracing. So from the start, it will be a bit difficult to just label the nerve. Here the nerve goes on, scroll down a bit more, and you see that the mental foramen is reached here. See for the end of the canal. Here it is. We go outside the reach, and here it is. This is just doing one side. We have finished one side of the arch. So we have traced the nerve from the left side, and we go on to the mental foramen from the right side. Here, so you can see here is the mental foramen. We go on again with the canal. You see the line. You see the just like tubular shape of the canal. We go on. Notice that we started from the most posterior part for the left side, and for the right side, we have to start from the mental foramen, just for the tracing to be consistent and to be continuous with the other side. Here is the canal again. You can scroll up and down if you cannot see the canal at some sections, so as to visualize it and don't miss any sections, or just don't mislabel the canal because it may cause misguidance for the surgeon or any other specialist or any dentist that needs help from the nerve tracing to do any treatment. This is again the canal. We go on to the posterior part. So here it is. This is the end part of the canal. We then just have a right click on it when we finish. And as you can see from this screen, from this section, the canal can be visualized so easily. You can see the canal here until the mental foramen, and here for the left side, here until the mental foramen. So you can see we have an impacted tooth here, so you can easily visualize the canal so as to avoid any complications, perceive if there is a possibility for injury during the surgery. So what we are going to do next is see this section again, store images, store the image, just in case sometimes you may not be sure whether the canal is traced well or not. You can go on this screen, click on different parts and see these slices for you to be more sure about the tracing that you have done. You can double click on it. Also, you can do some sharpness and adjust the highlights, adjust the brightness maybe if you don't see the canal well. But for this case, this is simple and this is enough, I think. So store image, click on this, store image, and then you see that we have a better view of the canal. Just maximize this selected part, maximize it, and then from the options here, click on this marker, use a size that can fit the canal well, just to visualize it better. So you see, I clicked on the large marker, large size. You start from the posterior part again. Just go on with the canal. There it is. This is assumed to be the nerve through the canal. This is the right side, and this is the left side. Let's go on with the canal. All right. Now we are done. We have a beautiful nerve tracing for this case. Now you can visualize in other parts of the software. You can even see the 3D. And you can adjust I'm gonna talk about this in maybe a later video. It's just for a quick idea of it. You can see here the canal, the tooth adjusted so that you can see both the canal on the roots of the tooth. You see here that the roots of the lower left 8 tooth is in contact with the canal. So the surgeon should be very careful when doing the surgery so as to avoid injury to the nerve. And here it is. You can also do a new multiplanar for the sections. See here that this is for another video too, but I want to show you a quick view for the visualizing. This is the sections, as you can see. Here is this section from the most posterior part and on the roots of the wisdom tooth. You see that the canal can visualize so well now and see that the roots are in contact with the canal. All right, this was about how to do a nerve tracing. I hope that it was useful and that you will benefit from it. Just in case you have any questions and queries, you can comment on the comment section, or you can just direct message me for that. I will stop the share now and leave the meeting. Thank you so much for joining. See you again.